bien voilà, après avoir fait de super grandes lectures dans des grands groupes, un peu partout dans le monde, il est ici, dans ce petit cabinet parisien. Mais voilà, merci de nous faire l'honneur d'être là ce soir, dans ce modeste cabinet. Merci.
You're welcome. Thank you, Anais. Welcome to part 2 here in Paris. Thank you for coming back today. We are very much dedicated to our purpose tonight because guess who's playing at the church Saint Madeleine? Frédéric Moreau. He's like the Edward Van Halen of French classical music. So he starts at 8:30, but that's okay. This is much more important. So what I want to do tonight is just what Anais said. I'm sure that I am the least religious person in this room. And it always makes me nervous when people confuse chiropractic with religion. But on the other hand, the idea of innate intelligence and universal intelligence is not some very extravagant, esoteric, cultist idea. It is very practical and down to earth and everyday and observable. You know, BJ's term was universal intelligence. If that offends you somehow, you can use the term intelligent design or life force or whatever distinguishes living things from non-living things. Innate intelligence in classical chiropractic philosophy means the share of the intelligent design of the universe that is present in your body. How our body manifests our participation in the intelligent design of the universe. That's as simple as I can make it. Yes. I know a guy, do you guys know Dr. Liam Schubel? Have you ever heard of him? And he uses the phrase, when he meets someone for the first time and introduces himself as Dr. Schubel, question comes, what kind of doctor are you? His immediate response is, well, I'm the kind of doctor that works with the power that animates the living universe. That doesn't just roll off the tongue. You have to practice that, but I use this example. What's missing from you go to the funeral and you see the cadaver there, the dead person. Well, whatever is missing from him. Michael Jackson had no more innate intelligence. His was all used up. You know, the tank was empty. Here are some everyday examples of you accidentally cut your hand in the kitchen and it's bleeding. Why, did that just happen?
Yeah.
Oh, okay. Very good, that's perfect, thank you. A live example, live ammunition, I love this. So, why didn't all the blood drain out of your body? Why didn't all the 5 liters of blood in your body drain out of your hand when you cut your hand? Innate intelligence, you know, natural selection. When you go to sleep at night, do you have to remember to keep breathing? No. The autonomic nervous system is part of innate intelligence. So this is just basic sciences, right? Reflexes. You touch a hot radiator accidentally, the sensation of heat does not even have to come to your brain and back again before the command to move the muscle is given. That's a reflex. It pulls away right away. Innate intelligence. And of course, the healing power of the human body is our most dramatic example of innate intelligence. And I've been injured so many times, it's ridiculous, but I admit that mainstream medicine has saved my life a couple of times, but they always want to do too much. They're really good at first aid. Anais, what's the word for first aid?
Premier secours.
Exactly. They're really good at that, but they're not so good at what comes next. They seem to want to do too much, but the healing powers of the body are enhanced so much by the adjustment and by clearing the spine and by making sure the nervous system in the healing body is operating at 100%. That's a real example right in front of your eyes. Now, there used to be a school a long time ago, I think it was in Pennsylvania, it was called the Audio School. Does anybody, this is an acronym, does anybody know what those 4 letters mean?
Above, down, inside out.
Yeah, how did you know that? That's right. Above, down, inside out. How did you know that?
I took some philosophy classes.
Okay. Now that's real old school. That's B.J. Palmer. So this is the contradistinction between the mechanistic philosophy of organized medicine and the vitalistic philosophy of chiropractic. Organized medicine, their whole theory is that you are sick. Our job is to figure out what drug or potion that we are going to give you from the outside that is going to cure you. Chiropractic is the opposite of that. The vitalistic philosophy holds that the power of universal intelligence from above comes down, and it's an inside out, from the inside out healing process. We want to get out of the way, remove all obstacles from the inner power of innate healing that the body has. Because ultimately, that's going to be the only thing that heals you anyway. All these corticosteroids and anti-inflammatories, they're okay for the acute part of the injury when it could be a life-threatening situation. But as soon as you're stable and you're starting to heal, any kind of drugs like that are going to interfere with the body's innate power of healing. It is the body's innate powers of healing that replaces all our tissues periodically. For example, the epithelial cells that line the gut are replaced every 5 days. You get all new skin cells every 2 weeks. Your erythrocytes, your red cells in the body, are replaced every 120 days. Your liver cells are replaced every year. Your skeleton, the bones of your body, all those cells are replaced every 10 years. The viscera, your internal organs, all their cells are replaced. You have a new one every 15 years. Now the problem is if you're a drug addict or an alcoholic or something, and let's say that you have a bad liver, your liver is diseased. Well, yes, it is true that the cells are going to be replaced every year, but the diseased cells unfortunately replace themselves with other diseased cells. That's the only problem. Someone in your family has a serious injury, and you're thinking about everything you can possibly do to heal that person as fast as possible, to relieve their pain, to help them get better, back to normal as quickly as possible. Remove the obstacles. Now, chiropractic is the only health profession in history that, number one, acknowledges the presence of a universal life force. Remember last night when I showed you all those web pages of the largest pharmaceutical companies in the world, and I showed you their mission statements? And you will not find one word about the salubrious benefits of their treatment or any benefit to the patient. Their entire mission is about what? Yes, exactly. It's about selling drugs. It's about more and more money. It's about getting a return on the investment of their investors, their portfolio, the investment portfolio. That's what they all say. Okay, so anyway, chiropractic is the only health profession in history that, first of all, acknowledges the presence of a universal life force that we all share, and secondly, claims an alliance with it. Chiropractic philosophy holds that the only way an injured person is going to return to health is if there is no interference between this universal life force and the part of the universal life force manifested in our bodies. I just listed various techniques, right? But there are dozens of chiropractic techniques. My opinion was chiropractic existed for the first 100 years practically, the primary techniques rather being the adjustment of vertebra. So we call those the osseous type of techniques. B.J. Palmer in the first 20 years of chiropractic, B.J. Palmer only adjusted 2 bones, and what were they?
C1 and C2.
That's right. For the first 20 years of chiropractic, it was all upper cervical. So the rest of the spine came later. But my point here is that chiropractic only exists in the world today. It has only survived in the world today because so many doctors all through the 1900s, they became masters at adjusting the bones of the spine. This is our tradition. So my opinion is that the new chiropractors in school should do everything they can to learn to at least do some kind of osseous technique, osseous adjusting at the beginning. And then if you want to branch out into the other more esoteric techniques later, that's fine, but you should have your foundation in the osseous techniques because that's really the traditions of chiropractic. Last night we used the analogy of a bag of tricks. Remember, and I said one technique is not going to be enough to help all the patients that you are ever going to see in your life, right? We need a few tricks in our bag. We need a few tricks in our bag, a few different techniques. It is difficult. It's like any athletic skill, it's like any musical skill. It is difficult to learn how to adjust the bones of the spine. That's difficult. Its difficulty should not be a reason that I see a lot of students and doctors just graduated, they say, oh, I don't want to hurt anybody, or I can't do that, that looks too hard. And they take a weekend seminar in Activator, and then they decide that that's going to be their entire chiropractic career. My opinion is you are, what's the word for selling yourself short, Anais? Okay, yeah, exactly. You're limiting yourself as a professional by doing that. Okay, and I talked about when I first started chiropractic college in Atlanta so many years ago, I was really lucky that Henri Gillet's boy, he had just come from Belgium and he knew all the motion palpation techniques, and we had a motion palpation club 3 times a week at noontime for 1 hour, and there was no talking, and we paired up doctor-patient, and so that's what we're going to do. When you're doing a setup, I'm showing the setup. Let's say that I already know what her subluxation is, C7 right, and I'm about to adjust it. Okay, so I set it up. Here's the setup. Okay. Now, that was it. It was very light. It was very non-traumatic. I have done this seminar hundreds of times for so many practicing chiropractors, you know, all over everywhere. But what frustrates me is these guys, I'll be in some city, you know, far away from home, right? And I'll ask some doctor who I've known for a long time, who's been in practice for 20 years, can you adjust me? And these guys, they've been in practice for like 20 years. They have successful practices. I don't get it. And they are what I call ham-fisted. How do you say that, Anais? Ham-fisted. Yeah, exactly. It's like there's no sensitivity in their hands. They come in like, rah, rah, and they just, oh, you know what they do? Okay, I'm going to show you a very systematic way to motion palpate the cervical spine. C1, C2, go right down, right? These guys, a lot of chiropractors, they disrespect the idea of motion palpation. I mean, a lot of chiropractors do this. Here's what they do. They come in, they go, okay, and they're talking to you. How in the hell can you find out anything? But I'm not doing it to her, but they come in really hard. There's no system to it. They couldn't possibly be discriminating anything. Now, not her, because this girl is like, her neck is perfect, but like a lot of people, your patients, they're traumatized. Neck muscles are in spasm. There's a lot of edema around it, and it hurts, right? And so if you go jamming your hand in, or even on the palpation, jamming your fingertips into those muscles, what's that going to do? The muscles are already guarding, they're already rigid to protect the neck, and you go in there and traumatize them more, it's going to worsen the spasm. It's going to make the spasm worse. So you must come in, the word is sub-threshold. Sub-threshold. How do you say that? Anais, sub-threshold. Do you know that word, threshold? It would be the point at which the muscles in the neck are tight at a certain level of tightness. You must touch them with less tension than the tension that is already in the muscles. That's called the threshold. We don't want to make the muscles contract anymore. They're already in a guarding position. They're already really tight. Gillet had a term for this. He had a word for this. It's an American idiom, but he said, with your fingertips, he said, you feel the spasm right away. You feel that spasm, you know, yes. And you melt through. He said, melt through, like an ice cream cone melts. He said, melt through. So that means very tentatively, you touch the affected area, you feel that tension, and then just very gently, but you can't just go in there and force it. If you go in there too insensitively, you're going to create new trauma, and the person subconsciously is not going to trust you, and they're not going to be able to relax while you make an adjustment. So that's my clumsy way of trying to explain, don't add new trauma. Now stay here a minute, please. You're doing really well. Let's have a hand for her. Okay, so what we are looking for, of course, is joint play. Anais, what's the word for joint play? Exactly, thank you. In the normal person like her, who has no trauma, who has complete range of motion, we can motion palpate for the joint play. You take it to the end of the normal range of motion, and then you just tug a little. You feel this springy feel, this springy feeling. That's joint play. Normal joint play should only be detected after the full range of motion. After the full range of motion. So for example, lateral flexion in this case, we take her all the way to lateral flexion, there's the limit right there, and then we push a little bit more, but not too hard, and we feel the joint play. You feel those two vertebrae moving a little bit. That's joint play. So in the subluxated vertebra, there won't be joint play. This is why it's so important to practice this 100 times, 1,000 times, 100,000 times, 1,000,000 times, over and over and over, so that your hands will know what is normal. Your hands will know what is normal. And then let's say that this patient has C4, C5 subluxation. C4 and C5 are locked together, let's just say. Okay, so we come in here and motion palpate her. C1 and C2 are perfect. They're moving normally. They have normal joint play. Now we get down to, what did I say, C4, C5? We get down to C4, C5, and it's like, uh-oh, they don't move. They're stuck. There's no joint play. Then we keep on going. We come down to C6 and C7, and that's normal joint play and normal movement. So I just described how your hands will learn to locate, to detect the subluxation, the primary. Remember, I call it the primary. Your objective for every patient who walks into your office every day is to locate the primary. I call it the primary. The primary means that subluxation which we are going to adjust to today. And that's the difference between physical therapists who just pop everything. You know, they go right down the spine like a typewriter and just adjust everything. That's not chiropractic. Gonstead said, chiropractic is specific or it is nothing. We get a lot of students, a lot of young chiropractors who always wanted to learn to adjust. Now, I gotta tell you guys, I had a very bad impression of the French school before talking to certain people here, and now I'm getting encouraged, so we're going to visit it tomorrow, right? But I'm getting encouraged that your school, the French school, is not quite so bad as everybody thinks it is, because you guys they actually do teach you to adjust. That's all I'm asking from a school. That's fantastic, you know. So, but what I'm saying is, most schools don't. In the past probably 8 years, I have been to almost every school in the world, either lecturing there or at least visiting there. And I'm telling you, most schools don't teach students to adjust anymore. So that's unfortunate, because that's the only thing that's going to determine whether or not you actually survive in practice once you graduate. So anyways, remember how I was telling you that every athletic skill, you are terrible at the beginning. Everybody is terrible at the beginning. You must be willing to be terrible for a long time, and then eventually you are not too terrible, and then after a little longer time you can actually do it. So when people are starting out adjusting, they're very timid. They're very afraid. I don't want to hurt the person. I don't want to break her neck. I don't want to cause a stroke. I don't want to break her back. You know, that's what you think. The second thing is the student doesn't even have the strength or the speed to hurt the person, even if he wanted to hurt the person. Remember last night we were talking about, we had that chicken, and I always ask, has anybody in this room ever killed a chicken with his bare hands? And I found those two guys in Wales who actually did it. Well, it's really hard to do that. It takes a lot of strength. Why?
I used it today for palpation.
You used that idea?
Yes.
Oh. Well, they were nervous about you adjusting them?
Yes.
And you said, listen, you ask them if they killed a chicken with their hands? All right. That's great. Not only are you not going to kill them, you can't kill them. You know, it's really hard to kill somebody. So we all watch too many Jet Li movies. The new doctor or the student's first adjustment. They'll get all set up. They'll say, okay, that's the setup. And they'll go, okay, now go ahead, adjust them. And they'll go like this. So we call this snail-like recruitment. That means really slow. When Tim and I do that seminar, and there's so many people in the room, and then we break off into groups, and everybody has to adjust. Everybody has to make an adjustment, right? And a lot of them have never done it before, and they're really happy that they make their first adjustment of their life in our class. It's fantastic. The one phrase that Tim and I say over and over the most to people who are inexperienced, just learning, what do we say? Okay, now try it again 10 times harder. That's what we keep saying. We say that all day long. Okay, good. You know, the person just goes, deet, and we go, okay, now try it again 10 times harder. You're not going to kill them. Remember, I told you this last night. 99% of strokes from cervical manipulation in the world are done not by chiropractors, they are done by whom? Now, they're done by MDs and physical therapists who took manipulation at a couple weekend seminars. That's true. And Gerald Klum, C-L-U-M, he's the guy who has all the sources and information on that. Okay, and then here's some other statistics from Klum. You're right, C-L-U-M. Did you know that in mainstream medicine, in the hospital, right, 1 out of every 45,000 people don't wake up from general anesthesia who are getting surgery? What would happen to our profession if we killed 1 out of every 45,000 patients? You know, but they get away with it all the time. Did you know that 1 in 15,000 neck surgeries have a permanent paraplegia resulting? How would our profession be if 1 in 15,000 patients had permanent paralysis? And then we talked about the salon shampoo. When women go to the salon and get their hair shampooed, and 1 in 8 million of them get a stroke from salon shampooing. Chiropractors who give people strokes, it's much, much less often than the shampoo girls. So shampooing is much more dangerous than chiropractic. That's the true statistics. So anyways, here's how D.D. Palmer tried to encourage people, to use sufficient force to move the bone. Quote, vehemently and forcibly, if necessary, awaken your patient from his dream of suffering. Your goal is to introduce as much force as is necessary to move the bone, but no more. Use as much force as necessary to move the bone, but no more. So, which is something you learn gradually. That's your goal. But the other thing is visualization. Visualization in the mind of the doctor. Okay, so let's say that I have the setup. It's all ready to move C7 right now. And it just, for 1 second, I visualize her C7 over against that wall there. That bone is no longer there, it's over there. Just for 1 second. And then as soon as the instant that the bone actually moves, your hands are dead. The instant that the bone moves and goes click, your hands are dead. No more force. So that's another athletic skill. It takes a long time to do that. I'm deconstructing here. These are the steps that you must go through if you're actually going to accomplish this, get this skill, master this skill. So maybe many of you don't want to learn to adjust cervicals in the chair. That's okay. The same principles apply to adjusting any of the bones of the spine. We are going to introduce as much force as is necessary to move the bone, but no more. And as soon as the bone moves, our hands are dead. Okay, we're almost done. Okay, so this is my question. In this situation where you're setting up on somebody, you know they have a subluxation, they're in pain, they came to you for help, there's no place else for them to go to get this help. Which is worse? Adjusting that segment too hard or too easy? Take a guess.
Too easy.
That's right. Why is that true? By adjusting too lightly so that the bone didn't move, you just made it worse.
Yeah.
You hurt them, they distrust you, and you didn't accomplish your task. So the first time you adjust a brand new patient, I always adjust with pretty much force. But then when like this patient here, I've never adjusted her before, but I would still adjust with sufficient force. But the second time that you just remember how easy people are to adjust, and the second time they come in, second day, it'll be much easier, much less force. My opinion is the minimum force, you should be using the minimum force necessary to move that bone. Any questions about that? Now this is something that I'm going to demonstrate, but this is called wait it out. And this is something that took me more than 10 years of thousands of patients. It took me more than 10 years to learn this. So you guys get to learn it right away. So no matter what technique that you are using, so let's pretend again that it's a C7 for her, and let's pretend that I am set up, it's to tension, but I feel that this patient is nervous and very much in spasm, and they're all tensed up. That's fine. You wait it out. You don't move until you get that 1 second opportunity. I mean, if you have to remain like this for 1 minute, that's okay. That's okay. And then when you feel them relax, just for a second, some doctors use little tricks, like they'll say, okay, now move your feet forward. Move your feet. And then they go, that distraction, 1 second distraction. Wait it out. Don't be in a hurry. Don't be in a hurry. So many doctors who have adjusted me, they're in a freaking hurry. They feel like once they got it set up, they have to adjust you within 3 seconds. That's unprofessional. It's not finesse. It's no finesse. Chiropractic adjusting is a finesse operation, okay? So wait it out. There was one other thing, wait it out, Wait it out. Okay. Yeah. I'm glad I remember this. This took me 15 years to learn this. This is specifically for adjusting cervicals in the chair. Let's say I'm doing C3. Be aware of the plane line of the discs. So C3 is more flat, parallel with the floor. So it's going to be like this. The lower cervicals are going to be kind of down, and the upper cervicals are going to be kind of upward. You know that, right? Okay. So what I figured out after 15 years is if you are about to adjust someone's neck and their chin is down. Now put your chin down. Yeah, exactly. If their chin is like this and you're about to adjust them, it's not going to work because you're jamming the facets. How do you say that? Jamming the facets.
Juste les fermer, imbriquer les facettes.
Yeah. He knows. Say it out loud.
Imbriquer les facettes.
Exactly. So all you have to do to correct that, when you notice that the patient has their chin down, right at that last second, you say, okay, yeah. You say, okay, now raise your chin. And as soon as they do that, as soon as the chin is up, then you do it. Always make sure that the chin is up in this kind of a situation of adjusting the cervical spine. Actually, that holds true for supine adjusting. A lot of you adjust cervical supine, right? The same thing holds true for supine. Don't adjust cervicals supine with this dude's chin down. It's going to be a bad adjustment and it might hurt him. It might be sore. So this guy's actually doing it right. You see how his chin is up? That's right.
Yeah, but it's just the opposite that what we learn at school because they don't want to make extension in the cervical vertebra for the artery.
I know. So we have a saying in English. Tell me the French equivalent, Anais. Those who can do, those who can't teach, Anais.
En gros,
Ceux qui peuvent apprendre ne peuvent pas.
de quoi, ceux qui t'apprennent, c'est ceux qui font pas. Donc,
Ceux qui savent faire font, et ceux qui ne savent pas faire.
What kind of practices do these guys have who tell you this stuff? So if they could practice, they wouldn't be teaching. Unfortunately, that sounds, what's the word for cynical?
Same.
Oh, okay. It sounds cynical. So, okay, we already talked about 1 millimeter and Bruce Lee last night, remember? Mm-hmm. Okay, so when you have somebody in the setup and you're just about to adjust, if you have to wait, that's okay. Wait. But then when you feel that instant, your opportunity, you do it. Do not go like, okay, I'm set up. I'm waiting. All right, she's ready. And a one, backing up. No backing up, not even 1 millimeter. Bruce does not even think about backing up. Okay, I think this is my last slide. What's the word for sniper in French? Really? I was in Oklahoma City one day and I needed a ride to the airport. So one of the guys who attended the seminar, but he had just come back from Iraq and he was a sniper. But here's a phrase that the snipers use in training. Because obviously if you think about moving 1/100th of a degree, you're going to miss, right? He's that far away from you. You have to breathe. In the natural respiratory pause, they call it the space between heartbeats. When do you pull the trigger? You pull this trigger in the space between heartbeats. So it's just like making the adjustment. Refine the sensibility to wait for the exact, precise, right moment, the best moment to make the adjustment. And once you know that, go for it. Don't hesitate. Don't hold back.